A health coverage exemption is a provision under the Affordable Care Act, ACA, that allows certain individuals to avoid the requirement of having health insurance coverage without facing a penalty. Here's a brief overview of who qualifies for health coverage exemptions. Income-based exemptions. Individuals whose income falls below the federal poverty level and are not eligible for Medicaid may qualify for an exemption. Also, those who experience financial hardship due to high insurance costs relative to their income can apply for an exemption. Short coverage gap. If you have a gap in health coverage of less than 3 consecutive months during the year, you typically won't face a penalty. This allows for temporary lapses in coverage without incurring a penalty. Certain hardships. Individuals facing specific hardships like homelessness, eviction, domestic violence, or the death of a close family member may be eligible for an exemption. These hardships must be documented. Religious beliefs. Some individuals have religious objections to health insurance, and they can qualify for an exemption. To be eligible, they need to belong to a recognized religious sect with these objections. Membership in a healthcare sharing ministry. Members of qualified healthcare sharing ministries may be exempt from the coverage requirement. These ministries are nonprofit organizations where members share healthcare costs. Native American or Alaskan Native status. Members of federally recognized tribes and certain other American Indian and Alaska Native groups are exempt and can use Indian Health Service, tribal, or urban Indian health programs. Incarceration. Individuals who are incarcerated are exempt from the coverage requirement as they receive health care through the correctional facility. Not lawfully present. People who are not lawfully present in the United States are generally exempt from the requirement to have health coverage. Short coverage gap exemption. You may qualify for a short coverage gap exemption if you had a coverage gap of less than 3 months during the year. It's important to note that to claim these exemptions, individuals often need to fill out an application through the health insurance marketplace or provide necessary documentation. Understanding these exemptions can help individuals navigate the healthcare system and avoid penalties for not having health insurance coverage as mandated by the ACA. However, the rules and requirements can change, so it's advisable to consult with a qualified healthcare advisor or the official health insurance marketplace for the most up-to-date information.
Looking for the best health provider with the coverage you need? Our network of providers allows you to create your own flexible plan and help you get the health coverage that you deserve. Speak with one of our health insurance specialists and get a free quote over the phone at 1-800-410-1206.